Hi. So my presentation is on the effect that anxiety has on children and their learning. So my name is Lili Todorinova. I'm 17 years old and I live in Queens, New York. I'm currently a junior in the Baccalaureate School for Global Education. And today I'll be discussing the different types of anxiety in children, media exposure as a cause for anxiety, different potential treatments, and problems that appear when learning with anxiety, as well as potential solutions that educators can use. So the main reason why I chose this topic is because of my overall interest in the field of psychology and more specific about the aspect of cognitive development in psychology. And I've also seen how anxiety can affect one's life and personal situations in my life. So that's why this research was really interesting to me. Overall, I also wanted to search for innovative ways to treat mental illness. So for my project, I decided to write a literature review research paper. And first, I found and read journal articles on my topic, and I also watched the documentary, The Social Dilemma. At the end, I made connections between all the information I gathered in order to write my paper. So when talking about child development, it is crucial to mention Jean Piaget because this is one of the most influential figures in cognitive psychology. He was a 20th century Swiss psychologist, and his theory about the stages of development in children are used and quite well known in the field of psychology. According to him, a child goes through 4 stages of development. Those are the sensory motor stage, the pre-operational stage, the concrete operational stage, and the formal operational stage. However, when a child goes through their development, it does not always go as smoothly as someone like Jean Piaget or other psychologists may have predicted. One challenge that can be encountered is anxiety. Anxiety actually develops from fear. And once the fear persists over time, it can increase the chance for generalized anxiety disorder diagnosis. And while fear is a completely normal emotion to have as a child, once this fear becomes irrational and it persists over time, as I said, and it becomes more of a fear of untangible things, this is when it may become a problem and it may become may turn into symptoms and eventually a diagnosis, as I said. So there are many different types of anxiety, but for the purpose of my research, I decided to focus on 3 main ones. The first one is GAD. So this is one of the most prevalent mental disorders in children, and some of the symptoms include fatigue, difficulties with concentration, sleep disturbances, restlessness, and irritability. And these symptoms can actually lead to problems such as high sensitivity to criticism, self-doubt, and the need for reassurance. The second anxiety disorder that I focused on is social anxiety disorder. And this can be characterized as the persistent fear of social situations. And some of the symptoms include sweating, respiratory distress, and palpitations. And those symptoms occur when the child is put in a situation when they have to interact with others or they have to speak in front of a larger group. The third anxiety disorder that I focused on is separation anxiety disorder. And this is actually the one anxiety disorder that is age specific, which means that it specifically occurs in children. And it can be characterized as the excessive worry when being separated from attachment figures. And those attachment figures are usually family members and often parents. So this anxiety occurs before and during the separation. So there are many different causes for anxiety in children, but the one that I focused on in my paper is media exposure, since it has become a major cause of anxiety disorders nowadays. It has become a widespread problem, and with time, this problem actually increases because technology becomes more advanced and children are exposed to different types of media, such as social media, at a very early age. So since children have early access and unlimited access to all types of social media, this can become a big cause for anxiety. So children are exposed to very heavy topics at a fast rate, and this is determined to affect their mental state. So also, some evidence and some research shows that young girls who use social media actually present with higher levels of depression, and there are higher suicide rates in young girls who use social media because of all the self-doubt and anxiety that social media can cause. And it is important to acknowledge that depression and anxiety are actually linked together, and they often occur together. So since the content on social media is endless, it can also lead to fast burnouts, which is also related to anxiety and mental health. So overall, I found out that while technology advances at an extremely fast rate nowadays, the human brain does not evolve at that same rate. And this can be linked to why media exposure is such a big problem. So I also looked at some treatments that can be used for anxiety. So one treatment that has been widely used over time is cognitive behavioral therapy, and it is a short-term and skill-focused treatment. The overall goal of this therapy is to improve a person's emotional responses by changing their thoughts and behaviors. So this treatment has actually proved efficacy with anxiety disorders in children, and also with people from different cultural and ethnic backgrounds. And this is very important when talking about treatments. This means that this treatment can be effective regardless of a person's background, and this is why it has been so widely used over time. However, I still wanted to research some more innovative ways that are present nowadays in psychology to treat anxiety disorders. And what I can focus on is ketamine. So, ketamine is a psychedelic drug. And while it does not have the best reputation, new research has actually shown that it can be an efficient alternative for treating anxiety disorders in both adults and children. So ketamine has been administered as an anesthetic through IV for almost 60 years, but nowadays it's actually being administered for anxiety disorders as well. And when a person is administered through the IV with ketamine, the patient falls in a trance-like state. The patient feels dissociated from the environment as if they're in a dream, but they're still awake. And this is very important to acknowledge because this means that their reflexes are still intact. And this makes ketamine a safe alternative for treatments. So another benefit of this treatment is actually that it offers fast relief when it's needed. And overall, I found that the ketamine can be used as an alternative for patients that have not benefited from other forms of treatments. So since learning plays a huge role in a person's and a child's development, I wanted to look more closely into how anxiety affects learning and therefore how it affects a person's development. So I found out that when talking about learning, you have to identify a certain way in which you have to measure this learning. So what I chose is school performance. So anxiety, as I said, can lead to depression, as well as difficulties with concentration and difficulties with creating peer relationships, especially because of social anxiety disorder, as well as poor self-esteem, as I mentioned earlier. And in more extreme cases, it actually can lead to school phobia. So overall, ultimately, these issues stop a child's opportunities to learn and develop skills that are necessary to do well in the school environment. And anxiety limits a child's ability to gain their ultimate and to reach their ultimate academic strength in the stages of development. So that is why I looked for potential solutions that peers, educators, and teachers can use for children who struggle with anxiety. And again, it's important to look at ways you can measure this, how you can measure anxiety. And one way that it can be used even in schools is specific anxiety scales. So these scales help determine the extent of anxiety. So this makes it easier to treat it and identify an approach. So as he said, people and children with anxiety struggle with the need for reassurance and high sensitivity to criticism. This makes cognitive appraisal and interference the perfect strategy for teachers that deal with students who struggle with anxiety. And overall, I thought it's important to say and advocate for a school-wide prevention programs for anxiety, because ultimately preventing an issue rather than dealing with it when it's already existent is a key to true progress, not only in treatment for anxieties, but in mental health as a whole. This was my presentation. Thank you very much.
Thank you so much, Lili. Very, very incredible presentation and so clear, which is really awesome. Let me just pause the spotlight. All right, so any questions, please put them in the chat. I believe there's one from Antonio. Antonio, do you want to actually unmute and ask your question? If you raise your hand, then you can ask it verbally. All right, give me 1 second. Oh, wait, sorry, can you do that again? All right, allowed to talk. All right, what's your question, Antonio?
So first of all, great presentation. I just wanted to ask one question. When you were referring to ketamine, although ketamine could be used for anxiety treatment, can it also be proven to be addictive later on, although being a safe alternative?
Yeah, thank you for this question because I think it's important to talk about. So, especially since it is something new in psychology and psychiatry to use ketamine as an anxiety treatment, all of its effects are not completely clear yet. And it can definitely be proven that it could be addictive, but I think it's important to acknowledge that with the right like inspection from the people and the right viewing and the right treatment for it, it can actually be a safe alternative if it's overlooked from the people who administer it.
Awesome, thank you. We have another question from Henners. Would you like to answer this live, Henners? I just made you,
Yes.
Great.
So first of all, really, really great presentation. I thought it was very insightful. I just had a question that if anxiety was brought upon in media exposure, would that be considered a form of social anxiety or just generalized anxiety disorder?
Yeah, I think that it can actually affect both and result in both of these anxiety disorders. But I would say that it contributes more to generalized anxiety disorders because with media exposure, people are not as exposed to real life social interactions. They're actually, I found that become more isolated because they don't reach this level of interaction with other people. So this would lead to generalized anxiety disorder more likely.
Thank you for your answer. And Sahar, give me 1 second. I will allow you to talk. Sahar had a question.
Oh, hello. This was such a great and informative presentation, and I really love your discussion about potential solutions for learning with anxiety, because I think it's always very important just to talk about solutions when we're speaking about mental health. So would you, to branch off of Antonio's question, would you agree that, or what are your opinions on psychiatric treatment for young children? Would you agree that CBT should be introduced first before medications, or medications could be a supplement with CBT, especially if we're talking about children, medication compliance may not be up there as adults would. So what are your thoughts on that?
Yes, I think this is a really important question because I do think that with children, CBT should be the first introduced treatment. And as I mentioned in my presentation, psychiatric drugs, such as ketamine, are usually used once another treatment doesn't show benefit, such as CBT. So if a child does not benefit from CBT, then a ketamine could become an option. But again, it should be with great caution and supervision from parents and the people who administer it.
Thank you, Lily. We have one more question actually from Ella in the chat, which is, did social media affect girls more than boys?
Yes, so I think when talking about social media and especially how social media affects a person's self-esteem, a lot of times girls are more affected because social media sets a higher standard for girls online. So while boys are definitely also affected, the research I found was more targeted towards girls and how because of the self-doubt that social media causes, it actually leads to higher depression levels and even higher suicide rates.
Thank you for that. Very important for us all to